It's actually not a new concept. I mean, Dr. Van Ludwig there in Germany was the first one to indicate a connection between angina, heart pain, and oral infection. As we've increased our knowledge, as technology has allowed us to identify DNA of bacteria, the link between oral bacteria and bacteria that cause heart vegetations or cause overgrowth of the heart or problems with the coronary arteries has been directly linked. The problem is that, particularly to the mouth, if you have an infection in your hand or your foot, it gets filtered all the way back to the heart. Infection in the jaw goes straight to the heart. Oftentimes, your oral infection is the one that goes undiagnosed because it's unseen and it tends to have very few symptoms that we would be aware of. Mouth odor, later on the gums become a little puffy, and shrinkage of the gum tissue, tooth mobility, but by the time you get to where the teeth are mobile, you've had the problem for a while. Usually though, periodontal disease is not associated with pain until the very end stages. If it doesn't hurt, we don't worry about it. If you had bleeding on your fingernails, you'd be seeing the doctor the next day. But for some reason, bleeding gums doesn't excite people, but it should. Because if your gum's bleeding, then that means that the seal of your gum tissue to the root of the tooth, your seal that prevents bacteria and harmful elements from getting in, has been compromised. The easiest way to prevent it is see your dentist for regular examinations. They're going to tell you if you have gum disease, if you have other types of oral infections, or if you have oral cancer, and not only see them, but go in for the cleanings that they recommend, because that's where you guarantee the health of your teeth, and that leads to increased chance of having good health yourself.